Yes,
Yeah.
ma'am.
Okay.
I'm present here.
Yeah, she's from Zoology and Biotechnology Department, Government Science College. She would be speaking on prevalence of diabetes and its risk factors in the local urban population of Jabalpur. Yes, Miss Parnavi, you can
Should
start.
I start, ma'am?
Yes, please.
Okay, ma'am. Ma'am, can you see my presentation?
It's
Ma'am?
visible. Yeah,
Yeah.
it's visible.
Okay, I'm starting it now. Good afternoon, everyone. I'm Parnavi Arya, Research Scholar, Department of Zoology and Biotechnology, Government Model Science College, Jabalpur. My topic is prevalence of diabetes and its risk factors in the local urban population of Jabalpur. Now, coming towards the introduction, we all know that diabetes is a major non-communicable disease ranking as a leading cause of death and disability worldwide. It is one of the greatest public health threats of the 21st century. Diabetes mellitus can be defined as a group of disease characterized by high blood sugar level, which is due to defect in body's ability to produce or use insulin. Diabetes can be classified into mainly three types: type 1, type 2, and gestational diabetes on the basis of etiology and clinical presentation. Type 2 diabetes is characterized by insulin resistance and relative insulin deficiency, either of which may be present at the time that diabetes becomes clinically manifest. The main objective of this study was to examine the prevalence of diabetes to know the risk factors associated with diabetes. The rising prevalence of diabetes is related to rapid cultural and social changes, aging, urbanization, food habits, that is, dietary changes we have today, and sedentary lifestyle, which is very common, and behavioral patterns. World Health Organization's report has suggested that over 19% of total diabetic population of the world currently resides in India. Unfortunately, 50% of the diabetic population is unaware or undiagnosed of their diabetes status, which adds on the disease burden. Now, coming towards the methodology, the present study was a cross sectional study which was carried out in different pathologies in different areas of urban areas of Jabalpur. The study was conducted among the patients who visited the respective pathology for blood sugar level diagnosis as prescribed by their physician. A pre-prepared questionnaire was filled exactly as told by the patients, which helped to assess the data. The diagnosis was made according to the IDF criteria. Respondents of either genders belonging to age between 20 to 70 years were included in the study, while the pregnant females were not included in the study. Statistical analysis was done through SPSS, where chi-square test and regression analysis were used to study and to predict the risk factors. Variables in the present study were age, sex, alcohol consumption, smoking, tobacco, sedentary nature, and BMI, which act as the independent risk factors in the present study. While the diabetic and non-diabetic groups were, according to fasting blood glucose level that is more than or equal to 126 mg per dl, was dependent variable. The results, the present study comprises of 45% females and 55% males. In the sampled population, what we saw that 10.33% population were diabetic and 89.67 were non-diabetic. The table 1 shows the frequency distribution of sample population according to age group and sex. Now here, the table 2 shows the association of diabetes and various variables in the study, whereas we can clearly see that the variable age, that is group 1 to 5, we see that the diabetes cases were increasing with age, and it was also found to be associated with diabetes in the test. While the sex was not found to be associated with diabetes, sedentary nature was found to be associated with diabetes. Alcohol consumption, tobacco, and smoking, those are behavioral habits, were studied, and what we found was the alcohol consumption and smoking were associated with diabetes, while in our study, tobacco was not found to be associated in diabetes. In BMI, we saw that with increasing BMI, the cases of diabetes were increasing, and it was also found to be associated with diabetes. This was the association. Now, when we come to table 3, it shows the correlates of diabetes. In this, we see that all the variables here had some odds ratio, in which we see that age, sedentary nature, alcohol consumption, smoking, and BMI were the predicted risk factors with odds ratio like 1.004, 0.352, 0.164, 0.042 and 1.651 as an odd ratio, in which the BMI, higher BMI has the highest odds ratio, and it was predicted as a risk factor. Now, what we concluded through the study, the prevalence was 10.33 in urban population of Jabalpur. The associated factors predicted as risk factor in the present study were age, sedentary nature, alcohol consumption, smoking, and BMI. Diabetes was not found to be sex biased, so both the genders should practice healthy lifestyle. Prevalence of modifiable risk factor is high among the study population and among people diagnosed to have diabetes. Behavioral factors like alcohol consumption and smoking were related to diabetes, whereas tobacco consumption was not found to be related to diabetes. The economic boom and corresponding change in lifestyle are all affecting the level of diabetes. Given the disease is now highly visible across all the sections of society within India, there is now the demand for urgent research and intervention at regional and national level. This prevalence study is highly significant for society so that the policymakers and healthcare providers can implement the measures to prevent alarming increase in prevalence and management of diabetes, which will help in preventing further related complications. These are my acknowledgement. These are the references.